Hi, everybody. Thank you so much for tuning in to part 2 of my self-care presentation. My name is Janessa Decoste, and I am a registered nurse and a board-certified nurse coach. I hope that you found my first part 1 session to be helpful in speaking to the classes of experience and just getting an understanding, albeit quite a brief understanding, but just a look at what exactly self-care is. So I alluded to this a moment ago. So my name is Janessa. There I am in the little picture. I am a mama, I'm a wife. Like I said, I'm a registered nurse and a nurse coach. I am also a former Kids Cancer Care employee. So I worked for Kids Cancer Care for about 10 years, from 2009 till 2019. And I also worked at the Children's Hospital within the area of pediatric oncology, hematology, and transplant. So I have experience working on Unit 1 in the inpatient unit, in the clinic setting. I've done some hospital at home, and I was even one of the primary nurses for a little while there. So I do have some experience working in the area of pediatric oncology, and it's definitely where I've spent the majority of my career to date, even though I have in the last number of years made a shift in what I'm doing. Currently, I'm also completing my master's at the University of Calgary, and I'm doing my master's on the topic of the self-care practices of pediatric oncology nurses. So I'm just getting a better handle on how other nurses working in the area of peds onc are actually caring for themselves as much as they care for their patients and their families. So as I mentioned, currently I work in my own practice as a nurse coach, and I'm on faculty with a nursing institute here in Canada, speaking to holistic nursing and nurse coaching. So that's me in a nutshell. Thanks for listening to that aspect. So what we're going to do before we dive into the details of this session is I'm just going to do a quick review around grounding and centering. I think it's really important that we do touch on this, especially when we're talking about something like self-care. And I think it can be really important depending on what season or where you are along the trajectory of your child's diagnosis, whether you're in the thick of it all, or you are post-treatment, or you are a bereaved parent. So I really just want to take some time here and just kind of give an overview again of what grounding is. So sometimes grounding and centering can be used interchangeably, and centering usually refers to our mental and physical state of mind. So it's the place we know that we have to get back to when we're not feeling quite like ourselves. When we're not centered, we might feel lost or out of touch with ourselves. And when we center ourselves, we bring back calm to our emotions. So we do this by slowing down our breathing so that we might feel more of what's going on around us, so we become more present. And then centering and grounding, like we said, can often be used interchangeably, but grounding is when we explore kind of like the energy fields around us. So oftentimes we can walk into a room and you can just feel that the energy doesn't feel grounded and it feels kind of haywire. So we like to ground our energy as well. And one of the things you can do for this is just getting, sitting up straight, planting your feet into the ground, or whatever it is. It's just a two-part process essentially, where you center yourself into the moment, into the present, and then you ground yourself so that the energy becomes a little bit more stabilized around you. And then we're also going to set an intention for this presentation as well. So an intention is really putting a purpose to something. So for this particular presentation, we're going to set something around how you would like to take what you learn here today or implement it into your life in a different way. So we're going to put a purpose into the things that you learn here today. And some of the things that we talk about you may already be well aware of, and other things I just kind of wanted to open and expand your mind and get you thinking about foundational self-care pieces in a different way, because it can be really easy to think that we're doing really well in terms of self-care, but there's just so many competing factors that sometimes take us away from caring for ourselves at an optimal level. So before we actually set the intention, I'm going to take a few minutes here and we're going to do a quick mindfulness exercise, and it's called Who is Listening? So in mindfulness practices, the focus is often on the feelings in our body and the thoughts in our mind. However, oftentimes tuning into our other senses can help facilitate a strong feeling of presence and awareness as well. So if you watched the first video, or you took part in the first video, you know that we really focused on the breath and focusing on our breathing. And what we're going to focus in on here is sounds. So what I would love for you to do is we're going to begin by finding a comfortable position. And when you're ready, allow yourself to close your eyes. And we're going to bring our awareness to the breath. But instead of focusing on that physical feeling of breathing and feeling it going in through our nose and out through our mouth, we're going to listen to the sounds of the body breathing. So we're going to inhale and exhale through the nostrils, and we're going to listen closely to any noises coming from the breath. So we're going to inhale and exhale out through the nose. Now I would invite you to open your awareness to the other sounds that might be present around you. Maybe you're in your living room, or maybe you're in your kitchen, or maybe you're in the hospital right now. You may notice the sounds of cars passing out your window. You may hear distant noise in your home. Maybe birds are chirping outside the window. Maybe you hear an IV monitor beeping. Maybe you hear, the gentle hum of the light above. Whatever is present, I want you to tune into it. So tune into that noise. Our minds habitually recognize what it hears. So when a car goes by, you immediately know that it's a car. Instead of identifying and defining what each sound is, try to focus in on the actual experience of hearing. So imagine that your ears are tiny microphones only picking up on sound. Recognize the rising and passing of the noise, how far away it appears, and from what direction it is coming, not necessarily identifying what the noise is. As one sound grabs your awareness, tune into it for a few moments. Experience the sound fully. Then open your mind and listen for other noises. Hearing mindfully, continue listening, investigating, and opening up. Now that you've had some time to tune in to a few different sounds around you, return back to your breath without forcing or straining. Encourage your mind to collect itself fully into the sound of the breath in your body once again. So inhaling through your nose and exhaling through your nose, and listening to the sound of your breathing. When you're ready, I would like you to open your eyes and move back into your present life. All the while, maintain some awareness of the sounds in your life. Notice the act of hearing during your day, and let it draw you back into present time awareness. Thank you. So what we're going to do now is we're going to go on to the next slide here. And we're going to take a moment, and I would invite you to get out a notebook and a pen. And I want you to take some time to set an intention for your time today while you listen to the presentation. So I'm going to read, my intention is to listen to this presentation with my whole heart to listen and experience perhaps new ways of taking care of myself. Whatever that intention is for you, take a minute and jot it down just so you have it there. Our intention creates our reality. And so if we put an intention to something or we put a purpose on something, it becomes a little bit more tied to our thoughts and our emotions and what we want to become of something. Okay, so we're going to go on now. So my hope is that at the end of this session, you'll feel validated and heard, and know that this session is meant to acknowledge that what you're going through is hard and unfair. My hope is that you can define what self-care means to you. So having your own definition of what self-care means and looks like can be fluid and an ever-evolving practice, and it's something that will shift and ebb and flow as you do. And then my final hope is that by the end of this session, you can take some of those core 8 foundational pieces that I'm going to share with you, and despite your current season, you can apply them into your life. So exploring how you can start to build a strong self-care foundation that will ebb and flow with you as you encounter whatever life throws at you can be incredibly powerful in helping you navigate stressful life events as they show up. So briefly, what is self-care? So self-care requires us to reflect on what we know about ourselves and what we need throughout our day, our week, our month, our year, and essentially throughout our life. So just because one aspect of self-care might work for one person doesn't necessarily mean that it will work for someone else, or that it's even something that they find to be helpful. So self-care is one of those highly individualized practices that there will be common themes amongst throughout everyone's life. And as we explore the Core 8 Foundation, which we're going to talk about shortly, we'll see that there are some underlying core elements that are important in self-care, but how we go about managing and utilizing those Core 8 foundational pieces is definitely going to be very personalized. I did allude to this and talk about this in the previous presentation, so I'm not going to go into as much detail, but I do want to talk about the 7 guiding principles of self-care. And these were created by a wonderful social worker out of the US, and her name is called Tracy Cleantis. So if you get the chance, I would recommend checking out her book because it is quite lovely. And it does go a little bit deeper into some of these principles. So number 1, self-care is a daily, lifelong practice. Number 2, self-care equals self-compassion. Number 3, self-care means taking personal responsibility. Number 4, self-care means noticing what matters to us. Number 5, self-care requires attention and responsiveness. Number 6, self-care must be realistic to be effective. And finally, number 7, self-care precedes self-fulfillment. So take a look at those and really just unpack what each of those would mean for you in your own life, because it may mean something to one person and something else to another. And that's why we often say that your self-care practices and your self-care foundations are highly individualized and highly subjective to you as your own individual person. So like I said, review through those, and if you ever have any questions about any of these principles, feel free to reach out. Yeah. The next thing I'm going to briefly talk about is the seasons of self-care. So we did talk about this in the first presentation as well. And the reason that I talk about seasons of self-care is because oftentimes in our life, we will be going through different seasons. So like we have the 4 seasons in our calendar year, we have winter, spring, summer, and fall. And typically when we're experiencing any one of those seasons, we know what to expect. So in winter, we know that things tend to slow down, we pause, we kind of tend to turn inwards and we hibernate. We become more reflective, more intuitive, and we are inclined to engage in like practices that really nourish us and make us feel comforted. It's really a time for recalibration and resetting. So we do nesting, resting, and like we said, that hibernation piece. We're really trying to simply just be in this season instead of pushing and overriding and constantly trying to be doing something. When we head into spring, you're starting to see like a freshness, new beginnings, possibility, and potential. You're beginning to arise from the depths of winter, and you can start to feel that shift. In spring, you feel the harness of like that budding energy building. It can be slow, but it's starting to peak, and you know the buds on the trees are starting to come out. And spring is really a great time to implement new rituals into your daily life because you're feeling inspired and renewed and filled with energy after that hibernation period that you're coming out of. Summer, so after spring comes that fullness of summer and the peak of our energy. This is a time where we're expressive and we want to use that creative potential that we all have in us. It's a time to play, have fun, not take life too seriously. You want to share things with other people. Typically the days are longer, there's more light, so you feel like you have more time to really embrace all the things that we really have in the summer months. And then we shift into fall. So once summer begins to dissipate and, you know, the days get shorter, it gets chillier, it gets colder, we find our energy slowly starts to wane, and we may need to feel that we need more sleep, and we need to honor those changing rhythms. And we may see that we really need to rest a little bit more. Autumn or fall is typically that time where you really start to feel like you sabotage some of the things that you really embraced in the summer, or maybe you're starting to fall into old patterns that you don't necessarily love to fall into. So fall is one of those times when we're really getting ready to go into that hibernation phase of winter again. And then putting this through a self-care lens, it's very, very intuitive as you know, when you're feeling like you need to rest and recoup and regenerate. Those are the times when you're usually in winter and you're just like taking the time for yourself. And then, you know, when we're feeling those springful moments and we're feeling that excitement of new beginnings and possibilities, that's when we're in those spring self-care seasons. And then, like we said, summer, same thing. We're feeling the peak. We're feeling, you know, super in flow with everything that we have going and all of that stuff. And then we ebb into fall, and maybe, you know, the excitement of what we've accomplished, and it's kind of like goal setting. So once you hit the peak of that goal, there's always that bit of a lull as you come crashing back down and realize that everything you've worked towards is now coming to a completion and to an end. And then what I wanted to do was put it through one final lens and acknowledge the fact that many of you on this call have gone through your own 4 seasons as you've gone throughout a diagnosis of your child with cancer. So maybe you're in the winter season of a diagnosis, and maybe you are realizing that all you want to do is, you know, hibernate in your house and be at home with your child and make sure that you're in a safe bubble. And then we have the added layer of COVID-19 right now. So there's just so many aspects that are causing us to have seasons outside of the actual season. So if you take some time and just think about how the seasons do shift and change despite the actual external season we're experiencing in nature, I would encourage you to go through and just figure out where you currently are in terms of seasons, where with your child and your diagnosis, and maybe you're off treatment, maybe you're a bereaved parent, and just figure out where you're seeing yourself currently in terms of seasons. Okay, so the majority of our time together, I am going to focus in on something I call the core foundation. So whenever I do work with any clients, and I work with a lot of nurses in particular, we really try to focus in on these 8 components of self-care, because I do really feel they are foundational pieces. And when you have a good understanding and a good idea of what each of these categories and areas looks like for you in your own life, you can really start to kind of tackle the world and whatever life decides to throw at you in a different way, because you have tools and strategies in place to be able to actually manage with these foundational pieces. So the first one is we focus in on mindfulness and breath. The second one is we talk about nutrition, and that's spelled wrong. So we talk about nutrition and hydration. The third one, we speak about movement. The fourth one, sleep. Fifth one is feeling the feels, or looking at our feelings. The sixth one is stress management. Seventh is connection, and that's human connection and spiritual connection. And then finally is the environmental piece, which includes digital detoxing and looking at all of the things that are in our both internal and external environments. All right, so the first one we're going to focus in on here is mindfulness and breath. So the practice of mindfulness is something that has been around for thousands of years. It's not a new concept. And these days we really are embracing mindfulness as a way to turn down the volume on a multitude of very loud modern demands that seem to go hand in hand with living on Earth as human beings. It is a way to get out of our reactive minds, to take a step back and think about what we're doing in the present moment. Accessing our breath is a free, simple, and easy way to bring our awareness back to the present moment. Some of the ways that being mindful or becoming mindful is that it can really help us fight stress. So when you're in the midst of a stressful situation, or when you're dealing with chronic stress day after day, mindfulness can definitely help give you the tools to step aside and gain some perspective. So simply stopping, like I said, and taking a deep breath will activate the body's parasympathetic nervous system, which helps to halt the productive of those stress hormones that we encounter when we put ourselves into those stressful situations. And the result is that you begin to feel calmer and in more control. So over time, you can harness the power of mindfulness to assess just how stressful a situation really is. And you can turn down that body's inherent fight or flight response. So with mindfulness, you can stop, notice what you're thinking, and start to shut down those fear centers that have gone into overdrive in your mind and are evoking that fight or flight response. We can also use mindfulness to manage pain, whether it's acute or chronic. And we can use it to improve our health. So studies have shown that practicing mindfulness can reduce the risk of chronic disease and conditions like high blood pressure, heart disease, obesity, type 2 diabetes. And they also suggest that the strength and length of our telomeres, so those are those caps on the end of our chromosomes, who will shorten or lengthen in association with aging and disease, may be enhanced by evoking mindfulness through like meditation or just simple mindfulness practices like we tried at the beginning of our session here. So without going into too much detail, because there is so much that we can cover on mindfulness, I wanted to share with you a few mindful practices that you can easily try. And there's tons of YouTube videos out there, websites, and books that you can find to really dig deeper into each of these concepts. So the first one would be deep breathing. So we use our breath as a way of getting in touch with our bodies. And there's many ways to incorporate deep breathing exercises, but a good start is to take an exaggerated breath. So inhaling deeply through your nose for 3 counts, then holding your breath for 2 counts, and then exhaling through your mouth for 4 counts. Really focuses on your breathing, and it really brings you into that present moment and brings you into the presence of just physically and mentally focusing on your breath. So let's do one together. So we're going to inhale through your nose for 3 counts. So inhale, 1, 2, 3. We're going to pause and hold, 1, 2, and then we're going to breathe out through our mouth, 1, 2, 3, 4. And you can physically feel your body shifting when you do something like this. And this is something, it's probably my favorite go-to, and I'll let you all in on a little secret. So when I worked on the inpatient unit, often going from room to room and answering call bells and, you know, coming in not really knowing what situations you were going to walk into, this is something that I would consistently do when I left a room. So maybe if I was taking off my isolation gown, or I was putting on a mask, or whatever I was doing, this is what I was doing in between those moments so that I could, you know, calm myself down, become present, and recognizing that while I was present in that room for that patient, now I was going to go see another patient and their family, and I wanted to be present in the moment for them. So it's something that as nurses, we encourage nurses to use quite often, and I would encourage you to use it as well. So deep breathing, super helpful. Another mindful practice can be using mantras. So mantras have been used for thousands of years and as a way to reduce stress and enhance mindfulness. So a mantra can be as simple as using a word, maybe a syllable, a phrase, or a sound that you repeat several times in a way to help you feel connected to the energy within you and around you. So maybe you are choosing to use a word and the word is calm. So maybe what you would do is you would just repeat calm, and you would say it as you exhale, and you can feel it when you're saying the word calm as you exhale. It really does make you feel calm. So using a mantra is a good way to be mindful. Another one is a body scan. So actively focusing on different areas of your body from your feet all the way up to your face helps increase awareness of your body and can really reduce stress and tension, because sometimes we don't realize how much we might be carrying in different areas of our body. So I would encourage you right now, I'm not going to go through one because it can take quite a bit of time to actually do this, but go on YouTube and just type in body scan and you'll come up with some really great guided ones that you can work through. Typically, this is a really good one to do lying down because you can really focus in and clench and release and feel each of the areas of your body. The fourth one could be positive thinking. So this is anywhere from just shifting your mindset and shifting your thoughts, and knowing that we always are going to be having thoughts. It's something that is a constant, it's an evolution. We're always thinking things, and sometimes those things are going to be negative and sometimes those things are going to be positive. So positive thinking is just learning to reframe or reshift when you feel yourself becoming more negative in how you're thinking about things. So positive thinking is a good one. And then one of my favorite things to do is practicing gratitude. And what we mean by this is this could be as simply as taking your phone at the end of the day and typing in 3 things in your notes section that you are grateful for that day. It doesn't need to be a lot, but when you start to think about your day in a different way and thinking about what you were grateful for that day, that can really, really help shift your mindset, and that will help with that positive thinking aspect as well. So there's some easy mindfulness practice that you can try anytime and anywhere, with the exception of the body scan, because you might want to have a little bit more privacy to do that, but they are really, really easy things to be able to do. So that was the first aspect of the core 8. So the next one is nutrition and hydration. And look, I spelled nutrition right in this one, so that's wonderful. So nutrition, can you hear? Get my notes. So nutrition means properly fueling and actually feeding your body the basic things that it needs to function. So that's high quality proteins, healthy fats, vitamins, minerals, and carbohydrates. And hydration is also an important aspect of self-care, because hydration, if we think about it, is probably one of the most, if not the most important act of self-care, because staying hydrated is arguably the most important thing that we can do, because we can only survive for a matter of days if we are not hydrated. So we'll continue on with hydration as an act of self-care first, since that's the one we just finished off on. So typically, hydration helps regulate our body temperature. It helps with digestion, absorption, and the transportation of nutrients. It helps us get rid of excess waste, and it does help our brain function overall. So all of our body systems, including the skin and the kidneys, work nonstop to balance the body's input and output of water and to maintain our fragile fluid and electrolyte balance. And this is something that I'm sure many of you are aware of, especially ensuring that your children get enough water throughout the day, and we should make sure that we're including ourselves in there as well. So when our brains become dehydrated, a few things could potentially and most likely will happen. We become more triggered by behaviors and words and things that are going on around us. We have to work harder to act instead of reacting. So sometimes when we're feeling dehydrated, we're more apt to react in an explosive manner instead of just acting and taking in all the facts and being able to process things. We can more easily have our fight or flight or freeze response triggered. And it alters our mood, making things less enjoyable to us, making little things seem bigger, that mountain out of a molehill type things. So it can really impact many aspects of our lives and how we're able to go about our day in a calm and confident manner. Experts generally recommend that drinking approximately 2 liters of water every day is, where we want to rest. And if we can get those 8-ounce glasses of water or 2 liters a day, then we're doing pretty good. So keeping that in mind. However, there isn't a lot of evidence to support that claim, but it is a fairly consistent one that we'll hear across the board. And then a way that you can see if you're actually maintaining this is to just notice what color your pee is. So I know, as silly as that might sound, when you're dehydrated based on what the color of your pee is. The darker, the cloudier, the smellier it is, then it's not necessarily meaning that we're getting enough hydration. So making sure that it's a light yellow color is great. And then sometimes it can be hard to drink a lot of water in the day. So, there's lots of things that we can do to ensure that you're getting as much fluids as you can possibly do. And we could eat like water-rich foods like watermelon, sparkling water, fruit-infused water, non-caffeinated tea is a great way to also stay hydrated. So there's lots of ways to get that hydration piece in, but I think ultimately it becomes a really important part of self-care, and just remembering that if we're dehydrated, we're not going to be acting and working on all cylinders, and we're not going to be able to process things like we would want to be able to do if we were feeling fully hydrated. And then nutrition. So nutrition's an interesting one. There's a lot of stuff out there. My philosophy revolves around the notion that good nutrition is ultimately a form of self-care. While it might not feel like you're getting a massage or doing any of the more, more fun things of self-care, it's definitely helps by benefiting your stress levels, your mood, your digestion, and the overall health of your system. When you're able to nourish your body and fuel it, then you're able to that much better get throughout your day. We all know that high stress levels take a toll on our health, but have you ever really taken a deeper look at the science of stress? There's a lot of research out there that talks about how stress impacts weight. It impacts multiple things going on in our body, such as homeostasis, and the overall way we're able to remember things, how we're able to recognize things, our cognition, and it impacts our immune system. So there's so many factors at play here. Chronic stress has been well studied for its negative effects on appetite, hydration, and the overall functioning of your GI system. How many of you can recall feeling unsettled or stressed or waiting for test results and your tummy is just not feeling optimal, and you know that something's off and you just you're not able to, feel like things are going to be okay. So stress, what happens here is it upsets the GI system, and you're not able to digest and absorb the nutrients, and it could lead to inflammation. So what that does is maybe causes IBS symptoms, or maybe it causes constipation or diarrhea, like we said. So, if you're not able to absorb the nutrients and absorb all of the great things that you're eating from high quality foods, this is going to affect your coherence. It's going to affect if you're feeling foggy, or in the afternoons you're feeling extremely tired. So there's so many things that are at play in terms of feeding you and fueling your body with adequate nutrition. It really is the building blocks for a great self-care foundation. And then there's a few things that I do like to focus on briefly. So when I do work with clients and we talk about nutrition and hydration, some of the first things that come up are always, well, what diet should I be on? Or what new trend should I be doing? Should I be doing a keto diet? Should I be fasting? How should I be doing this and that and the other thing? And I like to say, just ensuring that you're getting high quality proteins, healthy fats, vitamins, minerals, carbohydrates, and fiber into your body is a great way to ensure that you're fueled and you're energized and you're able to tackle whatever is coming at you throughout the day. I also am not a huge fan of like point systems and measuring out everything and counting every single calorie that goes into your body, because when we are able to eat the least amount of processed foods, the least amount of processed sugars, and really focusing on whole foods, that's probably the best diet that we could ever have. And I do want to say this as a caveat: I am not a dietitian. I do have a lot of experience reading through things like that with clients and exploring different things and how it does impact their body. But I am not a dietitian or a nutritionist or anything like that. I just have a very curious mind when it comes to a lot more things around like functional nutrition and stuff like that. So if it's something you would like to explore, always happy to have that conversation with you. So really, when we talk about nutrition, some of the things I like to say is just balance it out as best as you can, depending on what's happening in your day and what your situation is. So be as colorful as you can when it comes to nutrients and nutrition. We want to have as many immune boosting, inflammation fighting vitamins, minerals, antioxidants, and phytonutrients. The more color that you have in your food, so the more colorful fruits and vegetables, the better off you are. So get as colorful as possible. Eat regularly. So I know people tell you this all the time, and I bet you a lot of us fuel ourselves on coffee for hours and hours and hours, and then we get that hangry feeling at 3 p.m. in the day, and we're like, what is wrong with me? So I would suggest that be as regular as you possibly can be, knowing that there's going to be days when it's unavoidable, but trying to have those snacks that you've prepared or someone else has prepared for you. And I want to pause here for a second, because I know some of you might be in and out of hospital with your child or experiencing a multitude of other things right now. And it's easy for me to say that to you, that preparing, having things ready, and spending, a couple hours on a Sunday going through your pantry and figuring these things out is a lot to handle and a lot to tack on. But when someone does ask you if there's anything they can do to help you this week or today, maybe those are some of the things that you can say. You maybe it would be very helpful if they cut up some fruits and vegetables and put them in their fridge for you, or delivered them to you at the hospital. So whatever that looks like, asking for help as much as you need as well will really help you towards ensuring you get adequate nutrition throughout the day. Another thing I want to say is don't be afraid of fat. So we do need healthy fats in our system, and I'm not going to go into too much detail here, and I'm sure you have read lots on healthy fats yourselves, but do not be afraid of fat. And then adopting an 80-20 mindset can be a really great way to introduce more balance in your nutrition. So this kind of revolves around that 80-20 rule for basically anything in your life. So 80% of the time, you know, eating mindfully and eating as healthy as you possibly can. And then 20% of the time, you know, maybe indulging mindfully in treats and snacks and some of your favorite things and your go-to snacks that you've always enjoyed, and eating them without the guilt attached to them is a huge one. So those are some tips and tricks for finding nutrition and hydration and the balance and what that looks like for you in terms of that foundational self-care piece. Okay, so movement. This is a really good one as well. So your body wants to move. If we aren't connected to our bodies, that means we're spending most of our time in our minds, swimming in our thoughts and emotions. And I can tell you from personal experience that this definitely creates suffering. So like, look at it this way. The thing is, exercise can be different than movement. Just like dieting is quite different from choosing foods that will nourish our body. Like food is nourishing, so is movement. It's an important tool that we can use for emotional regulation. But the thing is, we have stopped moving, and oftentimes in our day-to-day, we're not even getting up from our desks very much. We're not going from room to room much. We might be sitting on the couch. Maybe we're in a hospital room with our child and we're sitting on the daybed or in the chair. We're really not getting up as much as we used to. And so in just a few generations, our lives have become drastically more sedentary than they've ever been. And this has caused us to become really disconnected from our bodies. So if you think about it, excuse me, most of us sit in front of the TV, we're on our phones, we have machines and vehicles and things that can do all of the heavy lifting that once we used to have to do on our own or help other people do. So we tend to really only notice our bodies when something goes wrong with them. We notice when our back goes out, maybe because we haven't been stretching. We notice when our muscles are cramping up because maybe we haven't been nourishing our bodies with the proper foods. So it can be quite dishonoring when we only notice our bodies when something is out of whack or something's not working as it should. So being able to notice when we're being more sedentary and not moving our body is a really important aspect of self-care. So if we're able to get up and maybe walk around our house, or go outside if you're at the hospital and walk around the perimeter of the hospital, or you know, just go for a walk down the street, or if you feel up to it, sprinting around a block, or just doing simple things that you can get your blood flow going and helping to, you know, kind of blast that stress out of your system can be a really important way to get movement in there as well. I did mention it a few minutes ago, but stretching is also a form of movement. We can stretch basically anywhere and at any time. We want to make sure that we're doing those things so that our body isn't going to be acting up, and we're going to be noticing it more so than when, like we said, when something goes wrong with it. So honor your body, honor how you're feeling, do that body scan and really take note of particular parts of your body that may be causing you distress, and figure out how you can move it from a day to day. Some of the physical exercise recommendations out right now is that we really like to aim for 150 minutes of physical activity a week. So that could be 30 minutes a day, times a week, but whatever that looks like, we really do want to start trying to incorporate movement into our day. And if a walk is what you do to move, that is amazing. So finding those little tiny pearls of what works for you is definitely going to help solidify that self-care plan for you. Okay, so this is probably one of my favorite topics to talk about. And honestly, I never used to care about sleep. No, that's not true. So I used to care about sleep, but I never cared about sleep until, as much as I do now, until I had my own child. And it wasn't just my sleep that was being impacted. It was his sleep, our family's sleep, the dog's sleep, everybody's sleep. So now it's something that I'm really passionate about. So I'm not going to spend too much time on sleep, but we are going to explore it. So Sleep is now known as the third pillar of wellness, along with exercise and nutrition. So when we look at sleep, we want to talk about like what exactly does a proper night's sleep entail? Well, it depends on the person. So some people aren't going to need as much sleep as others. However, teens aged 14 to 17 should aim for 8 to 10 hours of sleep a night. Young adults, so that's aged 18 to 25, and mid-aged adults, so 26 to 64, and I'm sure that's where we are all going to fit into, should shoot for about 7 to 9 hours. And I can tell you right now, on a good night, I'm probably only getting 7 to 8. So it's definitely something that you always want to be striving for. And I know if you're in hospital and you're with your child, or you're worried about fevers at night, and there's so many things that are impacting your sleep and that are keeping you up at night, this is definitely something that is something to strive towards and something to work towards. And then older adults age 65 and up, we aim for about 7 to 8 hours of sleep. So instead of going into too much detail about why sleep is so important and all of those aspects, I wanted to talk a little bit about what happens to your brain while you're actually sleeping. So for me, this probably was one of the biggest catalysts for me realizing that I needed more sleep, and just how important it was for me to get that sleep and what was happening for my body and my brain while I was actually sleeping. So your brain needs sleep to process new information that you have learned each day. So imagine you're a parent and you're going through the day-to-day of learning all about whatever type of cancer your child has been diagnosed with, and you're learning all these tests, and you're learning about all of the things that come along with this diagnosis. And imagine that you're not able to get sleep. So you're not able to close your eyes, and your body and your brain are not able to shut down and be able to process all of the things that you're learning about your child, that the doctor is sharing with you, that your nurses are sharing with you. It's going to be that much harder to really grasp when when new things are being thrown at you and when you're being asked to make choices. So sleep is going to be such a catch-22 for you all, and I understand that it's not as easy as me saying we all need to sleep, so please sleep more. I get that there's going to be competing factors for sleep for you and for many of us, but I did want to acknowledge that. So from the outside, most people don't look very active during sleep, but what is going on is really a completely different story, especially for our brains, as I mentioned before. Our brains don't just turn off at night. What's happening is, in healthy sleep, the brain is cycling through 4 sleep stages, each distinguished by a unique pattern of brain activity. We're not going to go into each of those 4 patterns, but I'm happy to discuss this further with you if you wanted to learn more. So one theory as to why our human brains need sleep is to retain their neuroplasticity. So that's the ability for brain cells to strengthen important connections and get rid of the less important ones. So this is like that regeneration at night. So keeping that really important information that you need, and then things that maybe you're not really using a lot, or your brain is realizing, oh, she hasn't been using that information very much. Maybe we don't really need to retain that or hold as quick a hold on that as we think we do. So during the day, when we're awake and exposed to new information, whether it's at school or whether it's out with friends, or like I said, maybe it's your doctors telling you new things about your child or your nurses, when we're closing our eyes and shutting down for the night, we are actually using an incredible amount of energy to process all of that stuff. So studies show that if sleep doesn't happen, things like storing memories, learning new information, honing and our deep learning and those analytical skills, aren't actually happening, and we're not able to process some of the things that we might otherwise be able to handle throughout our day. And sometimes if we don't get a good night's sleep, and we've seen this all, our mood can be greatly impacted as well. So I'm gonna just go through a few things that is actually happening to our body, not really going into too much detail, but there's about 7 things I think I was gonna touch on. Let me just check, yeah, 7. So the first thing is the brain is encoding memories. So sleep is critical for learning new information, which we have touched on a few times already. We need to sleep so that our brain can process and store and keep whatever we are learning. Number 2, so you learn new skills. The brain needs sleeps to process new things, so that it would make sense that the brain also needs to sleep to learn new motor skills. So think about when your child was very small. Oftentimes you would put them to bed at night, and maybe they had a really crazy day, or maybe it was one of those days where they were just all over the place and you knew they were tired, and you put them to bed that night and they had the best sleep of their entire young life to date. And they wake up and all of a sudden they can do this new thing, and you're like, what is happening? How is that even possible? So what's happening is, as your child is sleeping and as you go to sleep, your brain is actually able to make sense of processes that it's been trying to conquer and trying to learn, and you can actually learn how to do things while you sleep, which is so great. So that's why when those kids wake up and all of a sudden they can walk, you're like, interesting, isn't that interesting? My child is brilliant. So your brain is actually helping you figure out how to do things while you sleep. So number 3, your brain figures out how to apply new information in different scenarios. So have you ever been faced with a tough problem or a decision and you were told to sleep on it? So there's a reason for that. Sleep is actually how you're able to process those complex thoughts and come up with conclusions about whatever situation it is that you need to work through. So maybe for you, maybe it's your guys are deciding what you need to do in terms of treatment for your child, and you don't know what you want to do, and there's just so much information. So maybe a good night's sleep might be a good way to process and come up with a conclusion to how you want to approach something. Number 4, your ability to focus is greatly improved. If you have ever, and I'm sure we all have, stayed up into the earliest hours of the morning trying to finish a project, or maybe you got caught up on a really good show or a series on Netflix, you'll find the next day it's so much more hard to concentrate as you got earlier and earlier into the wee hours of the morning. Research shows that if a healthy individual only gets 6 hours of sleep per night, performance on like attention tests and like things like that actually diminishes and deteriorates over time. So people don't realize that we're almost all of us are actually sleep deprived all the time, and that's why we're not able to react and recognize things as quickly. Number 5, sleep helps maintain executive functioning skills. So the frontal cortex is particularly vulnerable to sleep loss, and that part of the brain is critical for executive functioning, which includes decision making and judgment. So, you know, if you're not getting enough sleep, maybe your risk tolerance goes down, you're a little bit more adept to take risks. You're going to be more likely to make risky decisions towards the end of the day and into the night, more so than you would during the day. So something to think about, that risk assessment piece of you or that risk management piece of you might not be as strong as it could be. It makes you less moody, less irritable, and less likely to lash out. I'm not even going to go into more detail about that because, let's be honest, we know that when we don't get enough sleep, and we can see it in ourselves, we can see it in others, it makes us moody, we're irritable, we're more adept to lash out at other people. So that's enough in one sentence there for you. And then finally, the brain gets rid of its waste. So while the brain sleeps, harmful toxins are cleared out. And typically this happens in those first few hours when you go to sleep. So that's, you know, typically between like 10 and 2 is when your brain is really getting rid of its waste. And that can be super important, especially as we age, because it has been linked between, you know, not enough sleep and Alzheimer's, and you know, the brain not getting rid of the excess waste that it needs to. So those are some reasons why sleep is so important and how it can really impact how you go about from day to day. So you can all, I'm sure, think of a night when you had such an amazing and restful sleep and how you felt so much better the next day. And I'm also sure that you can think about a time when you've had a horrible sleep and you could feel its effects from the time you woke up and as you progress throughout the day. So something to think about is the importance of sleep and how it impacts us all 24/7. All right, so the next one we're going to focus in on here is feeling the feels. So just one second here. So emotions can play an important role in how we think and how we behave. The emotions we feel each day can compel us to take action and influence the decisions we make in our lives, both large and small. So in order to truly understand emotions, I wanted to touch on 3 parts of an emotion. So the first part is the subjective component. So this is how you experience the emotion. The second part is the psychological component, how our body reacts to the emotion. So if you think about it, how many times have you felt nervous or embarrassed or scared and you felt that full body flush? Like our bodies actually react to how we feel. And then the third one is an expressive component, so how you behave in response to an emotion. So there's so many aspects to feeling the feels, and I think I'm not going to go into a lot of detail because there is a lot that we could go down a wormhole on right now. But I think one of my favorite things to talk to people about is reminding them that feeling our feelings is good. It's okay to cry. It's okay to feel anger. It's okay to feel embarrassed. It's okay to feel happy. It's okay to feel joyful. We want those emotions and feelings to flow through us, because when they do, we're that much better able to move on to the next thing. We're that much better able to process what we're going through. Our bodies are able to let it go through them and then feel it and then move on instead of building it up. We all know what happens when we stifle and push down emotions or feel like we have to be strong or have that stiff upper lip. When we do those things, it can be that much harder to try to regulate when things do get to be too much. So if you think about if you're angry at something or you're not liking how a situation is going, and yet if you never say anything and never allow yourself to feel how you truly feel about it, eventually it's going to erupt and explode. And sometimes there'll be people in our path, and sometimes we will explode at someone who definitely does not deserve to be exploded at. So feeling the feels is super important, and it is part of being emotionally intelligent. I was listening to, I think it was a podcast a few days ago, and there was this really cool way of explaining something, and I thought I'd share it here because it really made an impact on me, and I shared it with my husband, and I think he was like, oh, that's interesting. Very interesting. So there's 3 parts to our ego when we're experiencing things. So the first part is, as parents, oftentimes we take on that parental ego. So what we're doing is we're making sure that everyone is good, we're making sure that there's rules in place, we're making sure that the risks are minimized, and we're making sure that people are falling in line with whatever is set forth for the day. Maybe we have these things that need to be taken care of. Maybe we're trying to get out of the house to go to school, or maybe we're trying to get out of the house to go to work. So that's the parental ego, where we know how something is supposed to go. We're not very lenient. We're very precise in how we want things to happen. The second ego is the adult ego. So that's oftentimes the complete opposite of how we are in our homes, where we're our true selves, and sometimes we react in a way that's a little bit more strict with our family members, and we're a little bit less lenient with them. But when we take on that adult ego, typically what we're doing is we're compromising. We're allowing for spontaneity a little bit. If we're at work or we're interacting with other adults, typically we're cool, calm, and collected, and we're open to new ideas and thoughts. And we know that, we're a little bit more bendy, if that makes sense. And then the third one is the childlike ego. And so with this type of ego, this is where like many children, all children, not many, all children reside. And what they're living in is that world of emotion and feeling emotions. So we all know a child who may have had a meltdown or a temper tantrum, and they're letting those emotions override, and they're letting those emotions just flow through them so that they can get it out and get rid of it. And it's amazing when you think about it. It can be stressful in the moment when you're in the middle of a meltdown with the child. But when we reflect that back to ourselves, oftentimes we're like, oh, a child, so it's only a child that has that ego. But really, if you think about it as an adult, if we're driving down the road and someone cuts us off, we immediately evoke that emotion of outrage, and we just can't believe that that person cut us off. And sometimes it overrides that, that adult ego, where we're able to maybe go with the flow a little bit, maybe try to like think, oh, maybe there's something going on with that person. So feeling the feels and knowing where we need to express and let things out can be highly, highly helpful. And it's something definitely that that I would love to talk more about with you all, but right now we don't have the time. So, and if you want to learn more about those 3 egos I was talking about, reach out, because it was really interesting, and I'm sure I butchered it a little bit, but it's definitely a cool concept and something to really think about when you're dealing with your own emotions, your child's emotions, and the family unit emotions. So, yeah. Okay, so stress management. So managing stress is all about taking charge of your thoughts, your emotions, your schedule, your environment, and the way you deal with problems. The ultimate goal is a balanced life with time for work, relationships, relaxation, and fun, plus the resilience to hold up under pressure and meet challenges head on. So in terms of stress, I know we have talked quite a bit about stress up until this point. We talked about like the ability to self-regulate, and we did mention a little bit earlier on about the parasympathetic nervous system. But what I'm going to do is just go over a little bit about the science of stress. And I want to share with you a little bit more about how and why your body reacts to stress, and how being able to take control of your emotions can change how you feel about stress. So stress is an unavoidable part of modern life for all of us. And a lot of us have learned to use all sorts of different activities, from meditation, maybe mindful coloring. Perhaps we're at the other end of the spectrum and we're using alcohol or junk food, or binging on Netflix, or other ways to try to manage stressful things where we can kind of vacate what's going on in our lives. These management techniques, while some are helpful and some are not, are important, because what it's doing is it's allowing us to release and get rid of some of that stress. Typically, we want to rely on those ones that are going to be the ones that are going to really help us in a positive manner instead of a negative manner. So humans, like all animals, have incredibly complex nervous systems, which regulates bodily functions and has allowed us to survive over millions and millions of years. Part of this is the autonomic nervous system, which reacts and responds to threats in an automatic way and is governed by an old reptilian part of the brain. So higher brain functions like rational thought evolved much later and are governed by the new part of the brain. So the autonomic nervous system has branches. So this includes the sympathetic and the parasympathetic nervous system. The sympathetic nervous system is responsible for the fight, flight, or freeze response, whereas the parasympathetic is responsible for the rest and digest, or the feed and breed response. So when a threat is perceived, the sympathetic nervous system kicks in. In this state, all of our senses become heightened, vigilant, and detail-oriented. Our heart rate rises, our muscle stiffens, we may feel flushed, our higher thoughts disappear, and we're only concerned with survival. Are we going to attack? Are we going to defend ourselves? What are we going to do? So in this state, the ability to feel the body decreases because full attention is needed on the potential threat. So the issue with this is, often throughout our days, we go through multiple points where we're put into this perceived state of an actual threat, which in reality, most of those times is not an actual threat. So we're living in that chronic area of feeling like there's a threat, and our body goes into that fight, flight, or freeze, and it takes a lot out of us. So it's normal to switch between the sympathetic and the parasympathetic nervous system throughout the day, because that is what keeps us alive and functioning. So the fluctuation can look a bit like this. So you're sitting in a chair, you're comfortable, you have a cup of coffee in your hand or tea, and that parasympathetic nervous system is activated, you're resting, you're digesting. And then all of a sudden, you hear a loud knock on the door, like really loud. It's like, so knock, knock, knock. And then you sit up and your tea spills a little bit, and you're like, your sympathetic nervous system is activated and takes over, because you realize, oh, someone's at the door. Like, who could it be? Maybe it's a burglar. Like, your mind just goes to that worst possible scenario. So you like get up cautiously, you go to the door, and it's your friend, and they're talking to you in a cool and soothing voice, and you take a deep breath and you realize, oh, it's nothing to be worried about. And the parasympathetic nervous system takes back over. So, I mean, we're continuously going through this cycle throughout the day. And if the sympathetic nervous system can't be switched off, it can lead to anxiety, hypervigilance, insomnia, IBS. So, you know, you're not able to feel like your body's in coherence with itself. It's not in homeostasis. You're not able to get rid of some of the anxiety and the fear that you're constantly living in. So this self-protective mechanism can be caused by single traumatic incidents, or it can manifest over time. And that's what happens in many of us, is we come up against these fight or flight instances in our daily life consistently, and we're constantly living into that state. So tuning into our feelings is really an important part of helping to fall back into that parasympathetic nervous system, where we get to rest and digest. And when we're in this state, and we're in this state more often, we're able to rest, we're able to digest food, we're able to make sense of experiences, to process and to heal. And this can be a tricky thing to talk about, especially when you are going through a diagnosis with a child, or maybe you've just come off treatment and you're going in for blood work, and you know you're activated because you're feeling like this really is a fight or flight time. Like, you don't know what's going to be the next step, and you're concerned and you're worried and your anxiety's up. So if you're able to use some of these mindfulness practices that we have touched on, and activate and learn how to activate that parasympathetic nervous system as something that you can pull on and pull into your life on a day-to-day basis, it would be that much easier to help calm yourself when you come up against these situations where you are going to have that sympathetic nervous system revving up a little bit more consistently. So, stress, it's fun. Isn't it fun, guys? So it's definitely something that we want to pay close attention to. It's something that we want to be able to manage, and it's something that we want to be able to have in place so that we can truly get throughout whatever situations we're coming up against throughout our day. I'm not going to go into all kinds of strategies and tips, because we have talked about the importance of being mindful and finding things for yourselves. But definitely making sure that you have ways to do this is really important. I do want to put out the offer out there is I am learning this really cool technique called heart math. So if anyone ever wants to try a few heart math exercises or breathing experiences with me, let me know, reach out, and we can walk through a few of those. A lot of them are really helpful when coming up against stressful situations. It's used a lot with anxiety and depression, and it's definitely a really cool technique to really help settle your body, mind, heart, spirit. So reach out if you wanted to learn more about heart math. And then we have connection. So for this section, what I thought I would do is I'd read over my little synopsis here, and then I'm going to invite you to just pull out a pen and paper, and I'm going to ask you a few prompting questions. And it's just to get you thinking about what your connections currently look like and what you would like them to look like. So as humans, we have a fundamental need for connection and belonging. when we share our thoughts and feelings with others in a respectful manner and others do so in return to us, we begin to foster emotional connections. You can find connection in your spouse, your partner, family, friends, coworkers, community, church, so many areas, just about everywhere you look. It does, however, require being brave and allowing yourself to be vulnerable to share your experiences with others in a meaningful way. Knowing right now that we're in the midst of COVID and sometimes it can be a little bit more difficult to have human connection, we have turned a lot more to virtual connection, and that is something I would encourage you to explore, which I'm sure you have done lots of. But what I want to do now is just go through a few prompting questions here, just to get you reconnecting and connecting with people. And I think it's important to make these lists so that in times when you're feeling like you really need someone you can turn to, you don't have to rack your brain. You can just go and look at this list and say, okay, these are the people that I really am gonna make an effort with, and I know maybe these people have been trying to make an effort with me, and I'm gonna maybe reach out because it will definitely make a difference in that human connection piece, and that's a huge aspect of self-care. So first thing I would like you to do, make a list of some people that you've lost touch with and would like to see or connect with again. So maybe write down 3 or 4 people. Okay, so the next question, write down some actual days and times when you will reach out either over the phone or otherwise to the people that you've listed above. And then after you've reached out, write down how you feel and whether or not you want to continue connecting with them. Maybe at this time, it's not something that you want to pursue, but you've gone ahead and you've made that connection, and it has helped satisfy some of that human connection that we do need to serve that fundamental need of belonging. And maybe it's something that you want to explore further with them, and you want them to be more involved in your life, and you see them as being someone who you can turn to in times of need. And maybe you already have a very solid foundation of connection, and you have people that you turn to, and you have people that you rely on. And I think it's really important that we continue to show up in our connections even when things are tough and even when times are hard, and we want to fall back into that hibernation season. So connection, very important. Make sure you're able to connect with one another. Okay, and the final aspect that we're going to talk on right now is our environment. So when I talk about our environment, really what I'm talking about is all environments that you're finding yourself in and around. So we have our internal environments, we have our external environments, we have places where we spend time, so whether it's our homes, our houses, outside in nature. There's so many aspects of environment that impact our day-to-day life. And the one that I want to talk about the most right now, well, there's actually 2 I want to talk about. So I would love to talk a little bit about nature, so spending time in nature, and how beneficial and important spending time in nature is. And then I want to focus in on our digital environment and what that looks like, because it can definitely be an impacting environment, and it's one that we might use to escape. It might be one that we feel like we're connecting with the outside world and we're connecting with others, but really we're not necessarily showing up and really connecting to actual people in our lives. We may be like exploring others and exploring the experiences of others rather than living our own life. So digital environment is a huge piece, and that's why I always save it for the environmental category. So what I would like you to do before we talk about the digital detoxing is I want to look at the world outdoors. And I want you to, in your notebook, write down what your favorite season is and why. And then once you've done that, I want you to explore. And I thought this was really a powerful exercise because some of us, when we're going through treatment or when we have a child in hospital a lot or even at home a lot, and we can't really go outside in nature, we can't be around big spaces, or we're in the hospital and we can't have live plants and we can't have certain things in our environments. I want you to think of 5 ways that you can bring nature inside to you. So maybe it's having some special crystals or stones that you've cleansed in a river, or maybe it's a picture of a beautiful scene outside, or maybe it's a picture of a river or a water source. And I want you to just think of ways that you can bring nature inside to you so that you can still have those grounding things that you can rely on even when you might not be able to make it out to the actual outdoors. And then the final thing I would like you to do is identify and just take a few moments to write down your personal, so this isn't anyone else's ideal, but your ideal way to spend time outside. What does that look like for you? Are you a water person? Do you like to be in the forest? Do you like to be surrounded by the trees? Are you a mountain girl or a mountain man? What is your ideal way to spend time outside? Maybe your ideal way is to go for a hike. Maybe it's just to go to the river in the city. Whatever that is, paint a picture for yourself so it's something that you can reflect on and think about and imagine and turn to when you're feeling like you need to be outside and it's just not possible in that moment. Okay. And the final thing we're going to talk about today is, as I'm sure you're getting weary of listening to all my words, but the final thing is I'm going to read a list of 10 questions to you. And it's a self-assessment. And we're just going to pay attention to whether we say yes or no or maybe to these questions. And it's really a quiz about the signs that digital noise may be impacting you, your family, your health, okay? So the first question is, do you feel like you must be online every waking moment of the day? Yes, no, maybe. Does your computer or phone take away from your physical activity? Yes, no, sometimes, maybe. Do you use your phone while watching TV, eating dinner, or spending time with your family? Yes, no, sometimes, maybe. How long do you spend on social media each day? All day, a little bit, never? What does that look like? How many times a day are you interrupted by notifications on your phone or other platforms? All day, once in a while, very little? What does that look like? Do you take your phone with you everywhere? Yes, no, sometimes, maybe. Do you answer every single phone call, no matter what time of day or night? Yes, no, sometimes, maybe. Do you miss important conversations or fun activities with family or friends due to the need to be on social media or on the phone or on your computer? Yes, no, sometimes. Number 9, does your digital and social media use impact your sleep habits? Is your phone beside your bed? Yes, no, maybe, sometimes. And number 10, do you actually feel that you accomplish what you need to do in the day, or do you feel that your digital use takes away from this? Yes, no, maybe, sometimes. So take a look through your answers. And if you want, you can go back through this and just pause for each of the questions and just make some notes and take note of where you sit with all of that. And if you find that you're answering yes or a lot, or that if you can note that actually impacting your life, then maybe it's time to start looking at ways in which you can start to declutter your digital life, maybe without completely disconnecting, but as a way to start thinking about how you can go about your day while not using or relying on digital or social media use as much as you might be currently doing. A few tips or tricks that you can do is evoke something called a digital Sabbath, where you're not, you're picking a certain day of the week where you put your phone on mute or silent, or you leave it in a drawer. Perhaps you go through periods where you decide not to go on any of those platforms like Facebook or Instagram, and you take a full-on dedicated break from it. Or maybe you remove all of the apps from your phone and use your phone as a phone. So whatever those things look like, it's definitely something to get you thinking about how connected you are and how connected you actually want to be, and whether it's impacting your life and how you're using it. Is it impacting your life in a positive way? Is it impacting your life in a negative way? Are you using it to escape from the reality of what's going on around you? Or are you using it in a positive way? Is it something that you're using and you're finding it to be rejuvenating and refreshing? So whatever those things that you might be using it for, just think about them and think about how potentially you might go about slowly starting to change that if it is impacting you. It's definitely one of those topics that's a bit tricky since we do live in such a technological age, and there's so much that is connected to our phones and so much that's connected to how we use them and how we show up with them. And if we're able to take a step back and really address and assess what we're doing, it can definitely have a very profound effect on our self-care. The one other thing I wanted to mention is the impact that having your phone next to you while you're sleeping, and how it's definitely something that can impact your sleep cycle. It can impact your REM cycles, and it's something that will cause you to not fully feel rested in the day. And if you want to learn more about that, I'm happy to explore that with you as well. Like I said, sleep and all things sleep and how it impacts your sleep is definitely some of my favorite things to talk about. So definitely take a hard look at the environments that you're setting yourself up in and around. And one of my favorite things to have people do is set a little space for themselves up in their home or in their room or wherever they may be. Maybe you have a special environment bag with you where you put some of your favorite things in, and you can set it up no matter where you are. So whether you're at home, you're at family, friends, or maybe if you're in the hospital. So just some things to think about. So I hope you found that just going through a little bit more details of the Core 8 Foundation and how this is a great way to set up a good self-care foundation for yourselves can really, really impact your overall health and wellness. One of the final things I wanted to say before I sign off here is to give yourself time, because nothing in nature grows all year round. And I think that's really important, because as you're in these different seasons of your life and you're going throughout different aspects of treatment and non-treatment, and maybe you're a bereaved family, maybe you've lost your child, be gentle with yourself and take the time that you need to pour back into yourself, because it's just so important, and it is something that will help you become resilient and get through all of those tough times. So I'm just going to leave these questions for you to ponder. You can come back and pause and really think about them, but I want you to think about, what are you already doing really well? What elements of the Core 8 Foundation do you already have in place? What season are you currently in? And really journal on what that season looks like for you, and write it out and just explore how you're feeling in this season. I want you to look at, what are you already doing and what can you start to incorporate today? And how will you know that you have a solid self-care foundation? How will you know when you need to make changes? How will you know when you need to make tweaks? All really great questions to ask yourself as you reestablish and reaffirm what self-care means to you. Thank you all so much for listening to this presentation. I hope you found it helpful. I'm sure that they have provided my details for you, so if you do want to reach out, feel free to do that. You can also go to my website. It's thenursecoach.ca, and there you can send me some messages on there and I will respond. I did leave some prompts all throughout this video in case you wanted to reach out about a particular concept or topic, and I'm happy to have those conversations with you. I hope you have a great day, and I will talk to you all soon. Thanks, guys. Bye.